Welcome to the SIWIKE podcast, the only podcast that shares the stuff you didn't know you needed to know about jobs, careers, and life. The SIWIKE podcast, the stuff I wish I knew earlier.
Hi, everyone, and welcome to the SIWIKE Stuff I Wish I Knew Earlier podcast. We're here again with our guest host, Eram, and we thought we'd have a little bit of a conversation on resiliency and self-care. So you and your background as the trauma queen, right? You deal with a lot of challenging situations. So kind of by definition, you need to have a very resilient mindset, and I presume that you have a lot of self-care practices along the way. So quick definition, resilience, when I looked up on the Googles from Oxford Languages, it said that it's the capacity to recover quickly from difficulties and just general toughness, right? So I think that speaks to you and your personality a little bit with all the stuff that you do. But I'm wondering if you can share a little bit about how did you develop your resilience? Or did you always start with that kind of growing up, or did it develop along the way? And how did that kind of manifest itself?
Well, I can say that resiliency is not something that you possess. I think it's something that you have to kind of earn over the time period of life. And I think that you need to have life experiences to shape you, to make you more resilient. What I would say about resiliency is more like the bounce back, a person being able to bounce back from adversity or very difficult times in their life. It could be something that's personal or professional. And I think this is how individuals grow. I would say that going into my profession, my resiliency grew even more because when you work in emergency trauma services, I don't think a lot of people understand this, but when you work in a department such as that, you see a lot of things, you encounter a lot of things that are kind of the unimaginable at times.
Right.
And so there's people, there are individuals and professionals who can deal with it, and there's individuals that cannot deal with it. So that's why I say resiliency is something that you kind of have to work on, that you have to acquire over a time period.
Yeah, my simple example where I don't know if it's in the caliber of what you're dealing with, but when I was in university, I almost failed out of my course and my program, right? And having grown up being kind of one of the smart kids, it was tough, and that was kind of the extent of my trauma. So granted, I had a fairly privileged childhood, right, as you can probably tell, but in that sense, like it was like being like punched in the gut, punched in the face, right? Because I've never been so close to failure, but it did allow me to kind of bounce back and I guess, spoiler alert, I ended up doing a little bit better throughout the course of my university career. But I mean, that's a small version, or maybe kind of like the regular person's version of resilience. Can you like describe some of the challenges, or if you're willing to share some of those resilient situations that you'd have to overcome in kind of your daily work? Because I can imagine, as you said, see a lot of things that are unimaginable. There's a lot that you have to
there's
get over.
Things, when you see a lot of traumas, there's people that you see things that you don't really want to see, things that you probably would, what you've seen in movies in terms of violence, things that we've seen for real. But I would think that what has struck a lot of healthcare professionals at this time is probably the pandemic itself, especially if you are working first frontline. And when I say first and frontline, I'm talking about emergency trauma services, because we're the first people that you see when you go in. I mean, there has been a lot of reference made to ICU, and no doubt about that, they do have to maintain and continue to stabilize individuals. But a lot of the COVID first comes in, and any patient that comes into a hospital has to come in through an emergency department.
Right.
So a lot of people that we had seen were very, very sick, especially those that were not vaccinated. And like I said, I've said this before, and I'll say this again, people don't fabricate shortness of breath. These are people who were not even able to speak, where there's absolutely nothing else that could have been done except to stabilize them and put them on life support on a ventilator so that they could breathe. So a lot of individuals were heavily burnt out, left emergency, went to a different branch of nursing, or just completely left nursing in itself, or even left healthcare, because it was too much for them.
Mhm.
And I could say this from the beginning of the brink of the pandemic, even up until now. But I would say the first, second, and third waves were perhaps the worst.
Mm.
That people became burnt out, and exhausted, just from that. Um, Resiliency is kind of always trying to see a light at the end of the tunnel, trying to always see that there must be some good out of this.
Mhm.
And I mean, from what we've seen and from what we're dealing with in the current world situation, one could probably say and ask, well, what good could possibly come out of this?
Sure.
And that is an absolute valid question to ask and consider. But when you're going through a difficult time in your life, you have to have patience as well, as that's the way that I was brought up, is to always have patience. And so I think that's what kind of gave me a bit of my resiliency, in terms of, we're going to get through this. It's one day at a time. Things don't happen overnight. Just like they
Mhm.
say, Rome wasn't built in a day. Well, the resolution of this pandemic is not going to be overnight as well. It will take some time, but I don't think it's going to be overnight.
Mhm.
Um, so I think just trying to understand that we're doing our best every day. And, they say healthcare professionals are supposed to be heroes, and they give the absolute salute to them. And, but, there's only so much that a healthcare professional can do, because we too, just like anybody else, are regular folks that live out in society.
Mhm.
And so, there's only so much that we can do, and there's only so much that we can handle as well. And so that's why we take it one step at a time, one breath at a time. That's what I tell myself, and that's what I reassure my colleagues for, because it does get draining, even though you know we don't get as many COVID cases now. I mean, we still do have patients that are coming in, and we have been warned about a new variant, and that is the
Mhm.
fifth wave that's coming up. But we still have a lot of other patients that are legitimately sick that come into the department. And then there's the high influx of patients that could actually go to urgent care or family medicine clinics, but they won't have anything available for them, because the only thing they have available is virtual care, and that's, or a telephone consult, which is
Right.
probably not really the best form of care, unfortunately.
Right. Yeah, and I'd love if you can share a bit of kind of your self-care practices, because obviously that is quite challenging for anybody to do on a sustainable measure. Because yeah, over a weekend, maybe a week, most folks can manage that, but over like months, going on close to 2 years at this point, right? Where folks, it's no wonder that people are moving departments or going out of the profession altogether, because something that long can be definitely straining. But it seems like that you've managed to kind of weather the storm, at least for the most part. And we'd love to hear some of your kind of self-care practices that have been particularly helpful for you to keep your resilience over these times.
Well, I can also give an example personally,
Mhm.
where the third wave was definitely, and had been, and I mean, I don't know what else to say in terms of the future, but so far had been the real eye of the storm,
Mm.
um, so to speak. So I was faced with a heavy adversity recently, where I actually lost my dad to this very disease
Mm.
several months back. And he actually contracted this from work, where everyone else ended up testing positive, and he got very sick from it, that he ended up in the ICU, and he passed away.
Oh no.
Um, so during that time period, while my father was ill in the hospital, fighting for his life while on life support, I was also working alongside frontline, also caring for people who had COVID in the same
Mm.
situation, who are on life support.
Mhm.
And needless to say, it was not the easiest. It was very difficult, because part of my mind, most of my mind, you know, was caring for patients and doing everything for them and hoping and praying that, that for those who I care for is also the same that is received from my father.
Right.
The back of my mind kept on just thinking to myself, okay, well, at the end of the shift, I'm going to change up and I have to go see my dad and see what's going on there.
Right.
So it's like I had two worlds in my mind, because the pandemic has affected me personally, even before that happened to my father, because it's very difficult to see people suffer. It's
Right.
not an easy thing. But when it really, when it hits home, or when it hits to someone that you care about and that it becomes very personal.
For sure.
And so people ask me often, I'm not quite sure how you did what you did. And usually what I can say in terms of my self-care practices is that I'm someone who is very spiritually inclined. And so I believe a lot in prayer. And I think that's what kept me going, and, so to speak, kept me sane and kept me with the greatest faith and hope, to just keep on going and going in to do my job, but also knowing that and trusting that my father was receiving the care that he needed at the time while he was on life support. So, there's people that have different forms of care. Some are positive outlets, but unfortunately, a lot of other healthcare professionals have resorted to some very negative outlets in trying to cope during this time period.
Right.
But for me, I would say that it was prayer and meditation and just trying to look at a positive outlook on things. Even though that's not what actually had happened, but trying to just have a greater faith and letting that faith grow and trying to look at things from a different perspective. I think if anything, this experience had broadened my horizons a little more. And I think that even though I am a mature individual, I think that this has matured me even deeply so.
Yeah, and thanks so much for sharing, because I can only imagine what sort of trauma that would have for anyone. Like I don't even think I could fathom it. I don't know if I'd have the resiliency to be able to do what you did. So thank you for your service, and I'd love if you're able to kind of talk a little bit more of some of the more maybe the tactical strategies or tips where so is it simply just prayer? Is it like a daily prayer, just or is it multiple times a day, that sort of thing, or any particular ones? Or you mentioned meditation as well. Like how did it like for some people prayer is meditation, and for some people it's different, right? So to give folks, I guess, a couple of ideas in terms of how to incorporate that into their day. Something as simple as you wake up and you say prayer, go to bed, that sort of thing, throughout the day and all that sort of stuff. So very specific and tactical advice. If you can share any of that, I think that would be very helpful for folks.
Well, I think what we need to understand is that any obstacle that you have within your life, this is part of your journey. And even my father, who suddenly became ill and ended up on life support, from what I had realized was that was his journey. That was his journey in life. And that was his way. And so to me, yes, prayer can be a form of meditation, but see, prayer is when you have your thoughts spilling out. It's your utmost true emotions coming out with whatever you believe in or whomever you believe in. It's going deep down in your heart and your mind and saying what you feel and what you express. And sometimes I don't think that we can even say those things but it's expressed and felt deeply within your heart and your mind. So even sometimes I could say prayer isn't something that you say, but it's something that is felt. And it's also going on a deeper perspective of things, where if you're not able to say it, but but it can be felt on the other end of the spectrum. So it may not be heard, but it's felt.
Right.
So sometimes it doesn't need to be said. I think that meditation is more like an introspective approach on looking at the situation at a glance, just looking at the situation from a different stance. You know, to look at things in terms of the positive and negative aspects, the questions of what if, what if this were to happen? Why is this happening? If you are to meditate, you have to be you need to have a complete clear mindset. You have to be completely neutral. Your emotions have to be completely neutral. This is where you're actually clearing your mind, setting aside all distractions in the atmosphere around you, and just sitting and just thinking deeply about who you are currently in this moment, who you were in the past, what have you learned, what has changed, and what could possibly happen in the future.
Yeah, I think that's amazing. I actually had a bit of a tingle as you were talking about how prayer is felt, because it's like, yeah, it's absolutely one where like if like prayer in whatever religion, or even if you're not religious, it could be a very spiritual experience where you kind of feel that I don't know if it's kind of oneness with the universe, that sort of thing, but just like a kind of depth. I think you mentioned being expressed deeply is one of those things where it's hard to explain, but when you experience it, you know it. Those types of things. And I think meditation, yeah, it's definitely one of those skills where, I mean, there's so much research coming out there of the health benefits physically and mentally of meditation. So I encourage folks to pick up a version, whatever version it is, whether it's through an app or a class or an online or whatever it is. And sometimes as simple as, yeah, like a prayer is meditation, or can be, and sometimes just being present in the moment. A couple of things that I've been chatting with folks on things like resilience, and the topic that comes out is burnout, right? People are going, and sometimes without the commute, people are just keep on going. There's no boundaries at home, so it's hard to delineate kind of work and life. So people are kind of going and sometimes working even more than they could and should, right? So one of the discussions that I've had recently, actually just yesterday with someone, is the concept of like life happening to you, life happening by you, life happening for you, or life happening through you, right? So taking yourself through those different perspectives where oftentimes it's to you, right? Like, oh, why did this happen? All that sort of stuff. And then you have some agency and you take control of it, and it's by you, where you're like, I'm going to change the world and do all that sort of stuff. And then it's going through for you, where, well, to your point about what is the good that can come out of this, right? And if you can take that perspective, that's definitely helpful. And then eventually it's through you, right? To say, you know what, you're just here, you're transient, and life happens, and it is what it is. And then that kind of gets into that meditative and prayerful state. So what are your thoughts and experiences with that, or if that resonates with you at all?
I think that you need to experience life, whether it's positive or a negative consequence. If you're, no matter what it is, I mean, here's the difference though. If you're passive about things, it means you never really picked up on what actually happened. It means you're not incorporating that for the future, because you change yourself. Only a person can change themselves. If you actually were able to make a change in yourself and learn something and incorporate that in your life's journey, then you've definitely acquired something from it. You don't just let it slide by. You have to take these life experiences and really think about them. It doesn't go through one ear and out the other. You really have to sit down and reflect and say, well, I wonder, okay, so this happened. and why, and what can I do better in the future, to make myself into a better person, or, did this come for the better? Did I actually learn something? And sometimes if you're someone that's very spiritual, it can actually deepen and strengthen your faith, your prayer, and your spirituality, or your divine wisdom, or whatever you want to call it. So I think, it's based on, and I think the way that you explained it, where life goes through you and by you and for you, is the way that people perceive life. And you have these different types of folks out there in terms of how they perceive life. Some people say, okay, yeah, it just happened, life just happened. And then there's just some people that will have some of that effect, and some people become very affected and they change their lives drastically, or it changes them, and so they become different people, and some for the better and some for the worse. So
yeah, I think that makes perfect sense to me. And I love what you said about being, well, more active than passive, because if you didn't learn anything from the experience, you didn't incorporate it from yourself, then the next situation, whatever happens, will probably be a version of that same thing, right? But if you've already internalized it and it becomes a part of you, like, oh, okay, it's just another one of these, and then you're more at peace in that whole situation. So I think that makes perfect sense to me. One of the other things when chatting about folks about burnout is that there's a quote that says something to the effect of, we don't burn out because we do too much. We burn out because we do too little of what lights us up. So I'm wondering if things like prayer and meditation are things that energize you and light you up, or if there are other things that also do that for you as well.
Well, I think that prayer and meditation is kind of like the light that keeps you there, that kind of the spark that keeps you there and going. I think that's the motivation for you to do other things, to keep yourself lightened up, right? You need to have the engine going, right? So if you think of like a car, the engine needs to go, but like it needs its spark as well for it to keep going, to go different places, to go the lengths that it goes to, right? So just like people, we have this light within us, this spark, this fire, but where does that motivation come from is the question for you to be motivated to do other things. Like, yes, a lot of us have become heavily burned out from this pandemic. That's not a lie. That's very true. But what else keeps us going and motivated to even just continue basic survival is the next question as well, right? Or what light do we have within us to continue the talents that we have, like writing, or it could be blogging or vlogging, or it could be arts, or playing musical instruments, for example, something that I like doing. What keeps us going? What keeps us engaged? There has to be some sort of spark or fire that's going to keep us running.
Yeah, for sure. I think that's one of the things that it's very individual. Each person has their own things that kind of light them up and spark. So it could be something, as you said, as simple as playing some musical instrument, right? I know someone who turns on their favorite song and dances for 3 minutes, and then that'll recharge themselves for the day, and it can be quite uplifting for them. And I'd love if you chatted a little bit about kind of what could be done for our healthcare workers, because they're kind of bearing up the brunt of a lot of this that's happening. And I don't know if there's anything you can speak about from like what we can do to help, what the government can do to help, and some of the incentives that are there for each of us to help our healthcare workers.
So nursing in itself has always been a challenging profession. But I think the pandemic has made it even more so challenging. There's a lot of things. I mean, on all perspectives, we have high turnover, staff shortages. They're trying to make incentives to keep people. They have these incentives where they have these large bonuses that they're offering in different parts of the province, different areas of Canada, or even in the United States. But sign-on bonuses are just basically a Band-Aid solution, a short-term fix for a long-term problem, because what will happen after the pandemic finishes? It's still going to be an issue anyways. And I think that this is going to be a very big reflective process, because a lot of things in terms of managing the pandemic were not done quite correctly in a lot of the perspectives of healthcare professionals, and just individuals themselves probably had some pre-existing issues and personal issues that they were dealing at home. So trying to kind of balance on a beam, or like just even on a, um, on a daily basis. Both things can be very difficult for an individual. So, some people have just decided to leave the profession. Some people have decided to branch off elsewhere, just because too many of the traumatic experiences and things that they've been seeing, just even trying to manage an emergency department in general, for example, in addition to the basic emergencies that come in with COVID and everything, had made it exceptionally challenging and very taxing for a lot of us. So I think that, I mean, they had initially offered EAP, which is an employment assistance program with only
Right.
like several free sessions. But how much can that do for a, for a pandemic that we have no clue how long it's going to be running for, right? Indefinitely. We don't know, right? Because we have new variants running. We have, it's ever so evolving. This is such a novel virus. It's ever so evolving. We don't know how long it's going to be running for. So, I think what another problem that we've been having is a pandemic within a pandemic, which is the mental health issues. We've not only
Mm.
seen with patients coming in at triage and the amount of domestic violence and abuse that's been happening, and that surge coming in, but guess what? We've got another pandemic. It's our healthcare professionals that have mental health problems.
Right.
If they've had anxiety, it's probably going to exacerbate it even worse. Post-traumatic stress disorder, is that possible? Absolutely. Absolutely. The things that we've seen, like I said earlier, are unimaginable to any human eye. So, I mean, a lot of these individuals try to de-stress by doing things that they usually enjoy. But of course, there's the restrictions and, the possibility of another lockdown and whatnot. If you're someone that used to go to the gym and then you're restricted from doing that, well, what can you do to improvise that, for example? Or if you're someone that goes out for a run, well, if you can't really be going out in public in these areas, well, what can you do to kind of improvise for that? What they have done as well, or what the government has done, is they put out a new incentive. I think it's about $12.4 million that they're putting out there, to provide and offer programs for healthcare professionals. And I think that's a great idea, but I think that's also very long overdue, because this has been happening since it's gotten worse since the brink of the pandemic. So I think this should have been introduced quite some time ago. And even though it's a great idea, I think that it should have been introduced when the pandemic happened. I think that's what else has increased the stress of healthcare professionals, is the fact that we have more turnover and short staff. And this is not only
Right.
at one hospital, this is actually across a lot of hospitals, including the United States, where you have mandates put in for mandatory vaccination status of healthcare professionals. And now you're having this mass exodus of healthcare professionals who refuse to get the vaccine. And so they're leaving the profession. It's like, well, then who are you going to refill, right? So you have
Right.
individuals that are working not only on top of a 12-hour shift that's already difficult as it is, that are pulling 16, 20 hours. It's very hard. So, like when you have a lot of these problems going on, and in addition to that, when we have overcrowded emergency departments, we don't have enough bed space accommodations, trying to surge people, and then there's not enough. We have patients that are irate at triage. We have to deal with a lot of crisis interventions, nonviolent crisis interventions and preventions. Well, what do you do about that? And then nurses become sick and tired, so to speak, or healthcare professionals get sick and tired of the abuse on healthcare workers. And even I'm sure a lot of people have known and heard about the protest rallies that are going outside of hospitals, and how healthcare professionals are being harassed, whether it's physical or verbal assault on healthcare professionals. However, what has been also put in place for that recently is the legislation on that they're introducing, that if anyone is to assault or harass a healthcare professional, that they're going to be charged for that. So I think, again, this is something that is good. But again, why was this not, the question is why was it not introduced earlier on? Because this has been ongoing for quite some time. It's that it's just been exacerbated even worse during a pandemic, because there have been more issues arising during this time period, including those regarding vaccination mandates and masking, and just to name a few. So
Yeah, and what speaks to me on this is you mentioned earlier about like, well, what it can be good about this, and maybe shining a light on all these kind of systematic things and things that are long overdue and should have been done before. Maybe that's a small ray of hope for all of that stuff. Obviously, that's not good necessarily compensation for all the challenges that folks have faced, but at least it's something there. And if we can end off maybe on a high note in respect to things like self-care for others and taking care of each other throughout the process. So what are your thoughts around that, and how have people helped you? How have you helped others during these challenging times?
Well, as always, nurses have, in order to be a nurse, you have to have a form of empathy and patience to have to care for patients and their families. What we ask is that we do realize a lot of individuals are very frustrated, especially with the pandemic. And of course, there's that inner fear of contracting it and so forth. We ask that, to understand and bear patience with us, as we are doing our very best. In terms of helping ourselves, to each their own in terms of coping. If you're a healthcare professional that's out there, if you're someone that's trained to be a healthcare professional and you're feeling stressed out, do what you do usually to de-stress and to attempt coping, whether it's prayer, meditation, riding a bike, doing some art, reading a book, writing, journaling, listening to music, dancing for 2 minutes, dancing like no one's watching you, whatever the case is. That's important. If you feel unsafe meeting people in public, try to do it virtually. If you're someone that already has a pre-existing mental health condition, and this is for anybody out there, and you feel that you need someone to talk to someone that you feel that you can confide in. They now have services available, for everyone. And that's, and it's because of the safety of individuals, whether it's for myself, it's for a colleague, a family member, friends, or just anybody out there. If you feel, if you're feeling really depressed, really low, to a point where it may hit a concerning level, contact professional help. Come into the hospital if you have to. That's what we're here for. That's what we're there for. That's what we go through it ourselves, but we're there to help you as well. In terms of the general public, like in terms of how can we deal with what's going on, again, try to cope with it in the best way possible, but also do your part too. Don't go get vaccinated. Number one, get vaccinated. Number two, continue hand hygiene practices, just basic infection control procedures, washing your hands, keeping sanitizer on you, mask. Don't go to highly crowded areas. Only go out for essentials. As I've outlined this again and again, yes, I realize that there aren't very many people that are infected, but the infections can still rise if, there are some people that are vaccinated that will get it, but it's a very mild to a lighter form of it, as opposed to someone that's unvaccinated who will get more severe symptoms and have to end up being hospitalized. So, yes, I understand that are people being vaccinated, but please don't be so loose about it. And please don't just say, okay, yeah, we have to toss all these things out of the window. Like we don't have to wash our hands anymore and mask. That's not true. With historically speaking, pandemics run for quite some time. So we need to have patience, and we need to just kind of give it some time. And of course, with the new variant out, we have to be very wary and very cautious about, what to do next and how we need to handle this one, right? Because like I said, everything is ever so evolving. We need to understand how to prevent that transmission or lower the transmission rates. So that's what I myself say, but that's what I can say on behalf of all my colleagues as well. That's what we're asking of the public.
For sure. So just stay vigilant, because we're not at the end yet. Still keep all of your sanitation and care exercises there, and especially the mental wellness ones, right? So like you said, dance like nobody's watching, if that's your thing, like whatever it is that's yours. And I think it's one where take care of yourself, take care of others, if you can manage that as well. and we'll all get through this, and we'll be all stronger in the process, and we'll all definitely learn a few things, and we better, or else it'll hit us again later on for the times we didn't learn. So thanks, Eram, so much for joining us and having this discussion on resilience and self-care, and hopefully we'll have you back for a future episode.
Thank you so much. It was my great pleasure being here.
Take care.
You as well.
Thanks for joining us on the SIWIKE Stuff I Wish I Knew Earlier, the podcast. If you like the podcast, please subscribe on iTunes, Stitcher, or wherever you found this podcast. And if you can give us a review, that would be very appreciated. Feel free to contact me on LinkedIn at Lukidanu, Lukidanu, and the same on most social media platforms. And I look forward to hearing from you. Thanks. Bye.